Vet Girl podcast is sponsored by Blue Buffalo, the makers of Blue Natural Veterinary Diet. Providing clinically proven therapeutic nutrition for over 95% of indications, our veterinary exclusive diets are backed by 34 published and peer-reviewed clinical studies and adhere to industry standards, including AAFCO feeding trials. Blue Natural Veterinary Diet provides the results your patients need with the natural ingredients your clients demand. Visit bluevetconnect.com to see how we have science in the bag. Hi, Vet Girl here today, and super excited to talk to you guys about all things nutrition with Dr. Donna Raditic, who's a board-certified veterinary nutritionist. And Dr. Donna, thank you so much for joining us for today's Vet Girl podcast.
Well, thank you very much for having me. And I'm especially excited about this because I'm a crazy cat person. And this is going to be about cats, that's lots of fun.
Exactly. I always say we try to keep it 50-50 between dogs and cats, but whenever I can get a feline topic, I absolutely love it. And you know what? I'm going to admit, I recently got busted by my own general practitioner when I brought my cat in for a plump body condition score. So we'll talk about that. But before we do that, do you mind just giving us a little bit of background about who you are, where you trained, and what you do, just so our Vet Girl audience has a better idea of who you are?
Sure, I'm a Cornell grad, and I actually was a small animal practitioner for many years out in what I called RW, real world. I went back and actually did an alternative nutrition residency where I trained up at Angel in Boston. I go back to work, then I go down to University of Tennessee, train down there, took oxygen and whatever else I needed to do to get to pass the boards, and I became a board certified nutritionist. I sold my practice and I went down to Tennessee, worked the nutrition service, and was invited to join faculty down there where I worked both nutrition and integrative medicine because my practice was integrative. And I was there 7 years on faculty. I now live in Athens, Georgia, because my other half is Dr. Joe Bargis, who's taken a position at UGA. I didn't join faculty because I really enjoy consulting and educating and doing things like this, and it gives me a lot of opportunities to get the word out, and it seems to be working out quite well. I really enjoy what I do, interfacing with veterinarians and still interfacing with pet parents. I do referred clients as well.
I had no idea we were such kindred spirits. I actually graduated from Cornell. I was the first class to go through the PBL, the Problem-Based Learning Curriculum in 93, graduated in 97. And I also did my internship at Angel back when it was super, super hard and you worked 100 hours a week. And I'm sure you were also trained by Dr. Rebecca Remillard, world's most amazing nutritionist, that I really became passionate about nutrition too, because she did things that were just kind of practical, outside the box at the same time, and very innovative for even 30 years ago, which shows us how old we are. And then love the fact that you're in Athens because my two best friends are down there. My running partner and godmother to my son, Dr. Jane Quant, and my intermate and resident mate, Dr. Amy Koenig, my resident mate, Ben Brainerd. So love Athens, Georgia.
Oh, that's fantastic. Yeah, I got to tell you a little bit about Joe because people probably know his name because he's one of the gods of urine, the Poseidons and all that. But one of his other claims, probably the thing he's most happy or famous or wants to be famous for, is he actually takes care of the mascot, the UGA mascot, which is Aga. Yes, the bulldog. So it's really kind of fun. And he's done a couple of things with the students when they dress up, like Aga and, promotion, things like that. So yeah, this is a beautiful area. It really is. And I really like it here. I do spend some time up in the Northeast. That's brought up, Cornell, Ithaca, that area too, as well. So definitely fun.
Well, I have to admit, one of the reasons why I never took a position in Athens, Georgia, is all the Boas dogs. I couldn't handle it. There's just too many. Sorry, Georgia. But go Georgia football. All right.
Yes.
So that's the only time we'll talk about dogs, right? Let's focus on cats. Today, we're going to talk about obesity in cats. And, unfortunately, it's fairly common in pet cats. Again, my own cat, my personal cat got busted at the vet that I go to. And just want to talk to you about that. Do you have any numbers of how prevalent it is in cats? And what are some of the predisposing factors that pet owners need to know to help prevent this growing trend?
Growing and expanding, right? So, yeah, it's really interesting. A while back, I was putting together a PowerPoint on overweight obesity, and I was looking through my computer and I found a talk I'd done in 2013. Okay, so that was data that was collected prior to 2013 when I was doing my nutrition residency. And at that time, 30% of cats were overweight or obese. Now, fast forward a decade, we're up to 60% overweight and obese cats. I mean, that's incredible. It's doubled in a decade. And it's just mind blowing. And the other perspective when I think about this is you've got to step back and say, okay, we got 60% overweight, obese. What about the 40%? What does that population look like? Well, if you think about it, we've got cats with chronic diseases, we've got older cats, senior cats. I don't have an exact number, but if I estimated maybe 15 to 20% of those cats, there's the skinny ones, right? The ones we're trying to keep weight on. That may actually tell us we only have about 20% of cats with ideal body weight and body condition. I mean, it's just staggering when you think about it. And this trend, I mean, it's a trend, trending up and expanding, like I said. So, a couple of points I think with pet parents and veterinary speak, we've really got to start doing something. So, neutering, okay, it is important, especially with cats, feral cat populations. That's what my three are. They were feral cats and now they're mine. But neutering, when you remove sex hormones actually have kind of an effect on the appetite centers in the brain where they down regulate their appetite. So the way I phrase it to clients is I'll say, okay, they're looking for love. They're not looking for the food dish. They're looking for love when they have sex hormones. You remove those sex hormones, it kind of releases the appetite. And all of a sudden now you got a cat with the munchies. And as that cat goes from kitten to adult, neutered, now its energy requirements less. Now we have to take back food. And we're talking somewhere between 20 to 30% of calories. So taking away calories in a munchy cat, disaster. Next thing, pet foods, okay? Everybody, yes, there are labels on the back how much you should feed. Those are guidelines. It's only starting points. I get pet parents horrified that they're not feeding enough or not feeding that, what's written on the bag thing. That's a starting point. Every cat is an individual. And we need to also talk about how to feed cats. Cats are really different. They will hunt 24 hours a day and they're hardwired for it. They'll have a meal right in front of them and boom, a bird flies by and they're off hunting. So we need to start thinking about around the clock 24-hour feeding. And I really embrace this with mine because they're totally indoors. So I have automated feeders. I've got a 6 slot, I've got a 2 slot. Some of them now have cold packs so you can leave out canned food. People are afraid, and you have to say these things to clients. They're worried, oh, I leave out a can of food and it's going to get old and the cat will eat it and he's going to get sick. Now, the dog will gobble it, gobble everything dead and nearby, garbage, whatever, right? Most healthy cats, once that cat food starts to get dry and yucky, they're like, forget it. So, yes, there's cold packs or freeze the canned food, but providing multiple meals and then food puzzles. I am on Chewy, I'm on everything, looking for the latest, greatest. And I've moved into dog puzzles. My cat, I actually got one from a friend, her Border Collie and Jack Russell could not figure this level 4. Okay. My cat nailed it in 10 minutes how to get these treats out. So I'll use my wet food and then I use dry food for my cats. And I'll have these food puzzles. And I even mix up the timers. No, it's not exactly at midnight. It might be at 1, it might be at 4. I'm just constantly doing this, changing it up, finding new feeding 24/7. So the feeding isn't Donna, it is these puzzles. And that helps with urinary. And I honestly think it helps with environmental as they're indoor. I also think it can help with weight management as well, feeding them that natural and using that behavior.
I love hearing the fact that a board certified nutritionist uses an automatic feeder because I do the same thing, mostly because I purposely schedule it at 5 a.m. at an eighth of a cup increments. So my cat does not bother me first thing in the morning, but I absolutely love that. All right. Awesome, awesome tips. huge advocate. Oftentimes we don't have the time to educate our cat owners on this, our dog owners on this. This is something you can train your front desk staff to teach. These are things that you can sell in your clinic because everyone needs to know this information. Now, I did want to talk to you about cats and diabetes. Do cats come to you diagnosed with diabetes mellitus that are overweight, or have they lost a considerable amount of weight? And how do you manage these cats differently? Like by the time I see them in the ER, they are obese, but they're really muscle wasted. And per the owner, they have lost weight. So what do we do?
Yeah, probably I would say the majority of diabetic cats I deal with are going to be thin. I get the underweight ones. So I'm grabbing, the veterinary therapeutic diets, high protein, very low carbs, but those are going to be calorie dense diets, which are great because I'm trying to get weight on them. And then I'm working with the feeding program, again, trying to get the small meals in frequently. Love if they'll eat canned. The carbs are even lower in your canned food than it'll be in a drier food. So I'm using those diets on my thin diabetics, but I do on occasion, I will get an overweight or obese, and they're challenging. So I really have a long talk with the owners. If I can get the owners and the vet team on board, especially getting an owner to weigh the food, okay? If they will weigh the food, and this is another tip that goes back to the handout about what you were saying, let's make a handout or have the front desk talk about it or put it in on your website. Every cat, everything that goes in that cat's mouth should be weighed on a gram scale. Treats, food, dry food, you name it. Okay. So they know, and the owners are recording it. And every Sunday, all the cats get weighed. Okay. And I got to tell you something. What's really surprising to me, it dawned on me. Clients, for some reason, think we have magical scales in veterinary clinics and they cannot weigh, okay, because their scale weigh differently. And your scale is the right one, and that one, you're looking for trends, right? Are they gaining or are they losing? So I get my clients on board with this, weighing everything that goes in their mouth. Let's record it. Sunday weigh-ins with the cats. And my diabetic cats, what we're looking for is a very, very slow weight loss. So sometimes I can get that done still with that high protein, low carbohydrate diet. That's good. Sometimes I can't. Okay. So then you got to get creative. So sometimes I'll put fiber in to kind of dilute the calories into the food if I can. Sometimes pumpkin or psyllium, or sometimes what I'll do is try to maybe introduce and use that high protein, low carb, but then high protein, high fiber, the weight loss. I'm using a combination, to kind of find a sweet spot, looking for that slow weight loss. Obviously, following blood glucoses, insulin, all that's got to go into this picture. It's heavy duty stuff with these cats. Every one of them is different. I would love to tell you, here it is, magic 101, you do this and all your diabetic problems are gone. It's not. They are really tough cats to deal with, and owners have to be very committed, as well as the veterinary team, and we all need to work together.
Thank you so much for bringing that up. On previous Vet Girl podcasts, I've talked about I was also the crazy cat lady that would always weigh both my cats. And I did it monthly, not weekly, but I had it on my Google Calendar because if it's not on my calendar, it didn't happen. And I did it old school wise. I had a digital scale. I weighed myself. I carried my cat. I weighed my cat and myself. Then I had to do hard math. But I did this and I tracked it in Google Calendar. And the main reason why was because I had a chronic renal failure cat. And I had a cat that I ended up picking up her neoplasia because she was always 11.3. A couple of weeks later, she had lost a third of a kig, and then she was diagnosed with neoplasia. So we often forget about that ability. And there's great technology out there now. I have a litter robot, an automatic kitty litter that automatically weighs my cat. I know there are other scales that you can put the kitty litter box on. So we haven't made it hard. We may not have educated our cat owners on the importance of weighing their cat at home because I think it's difficult, but it's really not.
And what you're saying is so true too, because cats are so secret about everything. You find the dried vomit way in the corner under the bed, or plop of diarrhea behind the file cabinet. The dogs got bloody diarrhea on the living room couch and vomited all on your shoes, and there it all is. So we really have to help our clients to be detectives, to really find these things sooner. And it's been shown exactly what you're saying. If cats lose weight, that right away, you know how hard it is to get it off them, right? An overweight, obese cat. So if they're losing weight and you haven't done something, something is about to happen. It will often a disease like cancer, IBD, chronic kidney disease is preceded by weight loss anywhere from a year to 6 months. So that trend, and then again, just as that we're trying to prevent obesity, then they're trending that weight and it's going up and they can see that. Then if they can see it going down, it's, both vet visit time, light bulbs should be going off. So that's got to be all out there. We've got to be talking about that.
It's hard because sometimes pet owners don't even want to weigh themselves, right? But again, I always say as soon as your cat turns like 7 or 8, they should be weighed at least monthly. I love how you say weekly, but really something that we want to teach owners to be able to do. Now, as my 19-year-old cat was getting older, at about 13 years of age, we had moved into a new location. And all of a sudden, he started defecating outside the litter box. And of course, I associated with the move. And it ended up being another comorbidity, which was osteoarthritis, right? And this was a cat that I got. It was my first adult cat that I got, 30 years ago at Angel as a head trauma patient with multiple back fractures, tail fractures from animal abuse. So I knew this cat was going to have underlying osteoarthritis, probably from trauma. So I wanted to talk about that. We all know that cats oftentimes will have subtle signs of OA compared to what they show on radiographs. And I wanted to talk about some of the other comorbidities, again, like osteoarthritis in obese cats, being that we seem to be seeing an increased population of cats with osteoarthritis. Is it like in humans related to obesity, and how should it be managed?
Definitely, it is a comorbidity, and your overweight, obese cats, yeah, they're at risk for osteoarthritis. But I hear what you're saying. I mean, we know studies are telling us that, they get middle aged, probably 40% are going to have osteoarthritis or have it. And the signs, again, they're subtle. Maybe the way they jump, they're not using their back end, they're using maybe more their front end, the facial expressions for pain, all that stuff that's coming out. And we need to be, again, telling our clients about it. And then once they're 12, they're saying, okay, radiographs, you're going to see a lot of changes. But I bet you have, as I have, I've had cats that have been, they have arthritis and I will radiograph them and I'm making up lesions somewhere in that bone structure and it doesn't add up. And then I've had cats that you radiograph and it's like, how are you walking? Okay. This 1 and 1 doesn't equal 2. And I don't really have a study to pull this out, but I almost feel like their arthritis is made sure there's probably wear and tear, but I almost feel like they're more like a rheumatoid person, where maybe it's more of an immune base and inflammatory. So the changes in the radiograph don't always equal. But, having said that, whatever the etiology is, like yours, trauma, my guess, maybe rheumatoid, whatever, the elephant in the room is still you have a cat with osteoarthritis, you have overweight or obese, the weight's got to come off because that is going to be part of management as well as pain management. So now we're talking veterinary therapeutic weight loss diets. That's my go-to, okay? Because those diets are fortified. They're meant to be fed at lower calories. If you drop lower calories on some of the over-the-counter diets, they're not going to get all their essential amino acids and vitamins and minerals. You can, especially those amino acids, because what you're saying is true. They lose muscle mass. And if they're missing a couple of essential amino acids, not power packed into those muscles, we're losing lean body mass, which makes weight loss even harder because that metabolizes more energy. So using the therapeutic diets are the way to go. And then again, stepping these cats down to get them down to a healthy body condition score, real important for these guys with osteoarthritis. The overweight obesity it's a nightmare and it impacts so many of the problems that we see in our cats.
Yeah, again, I almost feel like we are graduating young associates, young veterinarians, where they're so used to seeing, that 6 out of 9 body condition cat, and then they see a stray cat. If you've ever traveled outside of the United States, you go to Mexico, you're like, oh my God, these cats are in amazing body condition. But I haven't seen one of those cats with an amazing body condition score in a hospitalized patient or, on a routine visit in the United States in a long, long time. So we unfortunately, as veterinary professionals, are really getting used to that 6 to 7 out of 9 body condition score as the routine.
I would agree with you. And I think, I used to, when I was on faculty at Tennessee, I mean, I had oncology next to me. That probably kept my eye because some of those cancer patients would start to melt. Those kitties would start to melt going through chemo and things like that. But you'd have to really get your eye back. You have to get your eye back to what a 5 looks like because so many of them are overweight. And that's really the time we need to be addressing it. I feel like you're right. We will do a physical exam and say, oh, this is a healthy cat, body condition 6, 7. That isn't. The American Medical Association considers obesity a disease. It is a primary disease. And AVMA doesn't call it a disease. It's overweight, obese, and then comorbidities. Well, to me, we have a primary disease, overweight, obese. Then you have osteoarthritis, or you have other diseases. We're dealing with 2 diseases. That's what makes this so tough.
Thank you for bringing that up. So important that we be aware of that. Now, I wanted to talk to you about the effects of obesity impacting the development of urinary tract disease. I always joke when I'm teaching veterinary students, when you think of your classic black cat, it's always the 2-year-old male castrate, obese indoor cat, right? It's usually the orange tabby, that what I call the 9 out of 9 body condition score. And I swear when I'm unblocking them, they have like so much preputial fat, it is hard to unblock them. What's the association with obesity and urinary tract disease?
Again, another comorbidity, hand in hand, 2 diseases. Okay. Now they're obese and now you're dealing with lower urinary tract disease. So, the way I tell clients and I talk to veterinarians is, okay, when you're feeling over those ribs and you're feeling all that fat, when you're rolling that orange cat around and that's all that fat, you feel that big belly of that fat. It's like a tumor. It's like a big cancerous tumor. It's like all the fat cells have expanded and they're gone wild. And they're secreting, right? They're secreting inflammatory mediators and cytokines and all this. And that's getting in the bloodstream. It's going to the joints, it's going everywhere. And yes, it's impacting bladder. Cats are, for me, they're like a hot mess. They are the epitome of pro inflammation, or what I call, the itis, right? The Latin for inflammation. They've got cystitis, dermatitis, osteoarthritis. They are itis. Then they hide it. Then they come out and they boom, explode, right? All the itis comes falling out on them. And you're dealing with your arthritis, your urinary disease, cystitis, and your overweight, obese. I mean, yeah, they are very, very challenging patients for sure.
We could do a whole different podcast on the association of inflammation in humans and obesity and metabolic disease. And for those of you guys who haven't read the book Outlive, I'm a huge advocate. You should take care of yourself. But you're so right. I never even thought about that. Cats are so inflammatory, right? And we oftentimes forget about that association with obesity in cats and that itis. Now, talk to me about constipation, because those same exact cats that present into the ER to me that present constipated traditionally have osteoarthritis. They oftentimes have something that affects their free water. So maybe it's their hyperthyroid, they have chronic renal disease, and oftentimes they're so obese they can't turn around and groom. So sometimes there's just a fecal ball that's blocking their rectal area. But some of these cats are sometimes muscle wasted too. So do you mind discussing the role of obstipation and constipation in fat cats?
Yeah. So, like you said, you guys in the ER, actually, there's a study done right in the ER that says, what do you guys see? We see fat cats that are constipated, and we give them enemas, and a large percent of them, it's not working. They're going home and the problem continues. So, constipation, not passing enough stool. Okay, we know healthy cats should at least once a day, if not more, be passing stool than once a day. Then, if you don't treat the constipation and it continues and there's a chronicity to it, then you get the glorious obstipation cat, right? Now we're blocked from rectum to ileocecal valve and all the stool, and it's a mess. And again, that is a cat that is not being treated appropriately. This constipation, obstipation it comes with overweight, obese, inflammation, usually the hydration disease, like you're talking about, kidney disease, diabetes, hyperthyroidism. And then we've got osteoarthritis, all these types moving, Remember how we used to tell you to put the cow in the back of the truck and bounce it around to fix the displaced abdomen things and all, take a dog for a walk and it poops, right? The cats need to move as well. It is a huge problem. And it's sad because if they progress even further into megacolon, now you're talking, subtotal colonectomies, surgery in these cats. So the damage, you've got to remember that the colon, the large bowel, is really where the water comes out, right? That's the last opportunity for water to get sucked out. So when it gets sucked out because of kidney disease, diabetes, whatever, then you've got hard, dry stools. And there's evidence to show that that fecal material in there is damaging the lining and it's damaging the motility. And if it's not treated appropriately, and whatever our treatments, I'm a nutritionist, so it's going to be food for me, okay? So, yes, fiber diets, excellent. And a lot of these companies have mixed fiber profiles, psyllium, soluble, insoluble, Secret Service, FBI combinations to help us bulk these cats up and pass stool. But on the other hand, I have played too with using that high protein, no carb on some cats when I'm not getting the effect I want with fiber. And I've had some cats that respond that way. And there's actually now a probiotic that has a small pilot study, but pretty interesting. They had some megacolon cats in that small pilot study and constipated, chronic constipated cats, and got some positives. And they were actually even doing some biopsies where they were looking at the colon health, the cells in the colon, and saw some regeneration of cells that were involved in motility. So it's a complex problem. But like everything in cats, it's like a double whammy. It's obesity, right? It's constipation, chronic kidney disease, osteoarthritis, multiple diseases all at once that you're dealing with and faced with. And to me, that's where, you got to have all the tools in that black box. And man, you got to have nutrition in that box, a lot of nutrition, and don't be afraid to try things. Reach out to these veterinary therapeutics. The companies have a lot of good backup, talk to them. It's got to be in there. You can't just ignore it. You can't do enemas and like you said, or unblock cats when you can't even find the back part of the cat. So come on, we got to get going on this stuff.
Excellent points. The one other thing I'm going to add is, and it's just because we're all so busy in the clinic, is it's asking the right questions. Like, how high is the side of your kitty litter box? And how many kitty litter boxes do you have? Do you have like a low profile one that's lower to the ground? How much litter is in there? Because I feel like with some of these obese osteoarthritic cats, having too little kitty litter isn't sufficient. And then there are just some cats where if it's overly full, they're more tippy and they feel more unbalanced. And then they're less likely to go into the box because they view it as too tippy and it, throws them off. And then it predisposes them to that obstipation. So again, asking those questions and taking that time to get that history. How often are they cleaning the water fountain? Are they scrubbing out the green stuff that's growing on the inside of it? Like, are they offering fresh water sources? So again, history is such an important part of that nutritional aspect of that general metabolic profile of that cat. All right, so speaking about metabolic, let's talk fatty liver disease in cats. First of all, what is it? Hepatic lipidosis, and is it only a problem in overweight cats?
Well, the stats will tell you that, typically it's middle-aged cats and typically, yes, overweight, obese puts them at risk for hepatic lipidosis. So what happens is the cat will have a period of decreased appetite or anorexia. Something's brewing, unless of course it's a cat that, got locked out in a room or couldn't get access to food or a stray or something like that. But, if the cat's appetite is depressed and anorexic, first thing it does is it starts utilizing that body fat and it's going to make calories. It goes right to the liver and the liver's churning, trying to blow calories for this cat. And the liver's overwhelmed. Fat starts depositing in the liver cells are destroyed, cat feels worse, boom, the cycle starts. And these cats, they crash. And, remember when I said to you, they typically eat around the clock, right? And they have to eat, okay? That's why you can't starve these darn overweight cats and obese cats. You can't starve them. I worry about them with hepatic lipidosis when they're overweight and obese and we're getting weight off and they're trying to get them out on the diet and they won't eat it and they're giving me the paw and all that. So, this is a really serious disease. I mean, these cats can die. We definitely can do a lot better job with them now because we get right on top of them. But you will, on occasion, too, still see even a normal weight cat or a skinny cat can potentially have hepatic lipidosis. So don't close your eyes to it. But more typically, it is definitely a lot more fat there to blow into that liver and the cycle begins.
Great, great information. As a criticalist, I've seen the whole gamut when it comes to hepatic lipidosis from the husband buying the wrong flavor of food and then the cat not eating and getting hepatic lipidosis. And they were a totally young, healthy cat to the ones that are in fulminant failure, where they're coagulopathic and they need a fresh frozen plasma transfusion. They need sub-Q vitamin K because they are truly severely affected by their hepatic lipidosis. So I always joke it's like pancreatitis. It could be outpatient or they could die,
Yeah.
right? So something we definitely want to make sure we're addressing appropriately. All right. Any other last concerns when it comes to obesity in cats, or any last clues on how we can efficiently and effectively talk to our cat owners about obesity?
So I will tell you, I love when you said talk, get the history. A lot of times when I do consults with clients, all I do is just ask them, what's happening, or, do you understand why you're here? Why did they recommend a nutritionist? And you listen. Coughs are hacks, they're gags. Everybody's got different words and descriptions of things, but getting a good history is essential, and listening to these clients and involving them in the prevention of overweight and obesity, involving them in the disease management. So I will have people do Excel spreadsheets, and they're weighing the cat, weighing the food, blah, blah, blah. And pretty soon, I guess I'm savvy owner, they do one better and it's a real fancy Excel spreadsheet. So I ask them if I can borrow it and I share it with other clients, so that they can see and they become part of the treatment, really looping them in. That's how you get them to be compliant. We need more research. Cats are second rate citizens to dogs. They got shortchanged in the nutrition research and nutrition studies. They are obligate carnivores. We don't know enough about them. We need more information, and that research is going to help us to make better diets, make better feeding plans, and how we're going to treat and manage disease states. I also think, again, the overweight obese, it's not a healthy cat when it's a 6 or a 7. I dread the morbidly obese cats. It's painful to see them on Facebook, and that's not cute. That's a cat who's going to have, the arthritis, the urinary, all diabetes, all the things we've been talking about. And it's not funny, So if we can catch them, that's the best way. When they are so morbidly obese, it's like watching grass grow, trying to get weight off them. You struggle. I struggle. I struggle. I joke with my friend who's also a nutritionist, and I just try to send them all to you. You have more patience than me, Give me an 11, 12-year-old cat, okay? And then they're overweight. You know what? It's okay, because what starts to happen at 11, 12? Well, if my client is charting that weight, like you noticed, a little weight drop, we start to see chronic diseases, right? Kidney disease, IBDs, cancers, and they'll start losing weight. I look like a hero. No, they are going into disease state problems. So again, it shows you the importance of getting the clients aware of how much they're feeding, and also being detectives and giving them the tidbits of, like you're saying, the litter boxes that way, put them on the gram scale, buy a baby scale, put them in a box. I don't care what you do, put them in their favorite carrier of the bag, throw them on, just weigh them, and keeping track of all this. We do all these preventions, we're doing vaccines, we're doing topicals, we're talking about prevention. 60%. We've got a population of 60% cats out there that need prevention from a primary disease of overweight obese that then tacks on another disease, if not another. You can't win with any of the diseases we've talked about, anything, when you've got this underlying inflammatory bomb in them. You're just constantly fighting it and fighting it. So you've got to bite the bullet with it. So, and it's sad for me to say that as a nutritionist. Give me a 12-year-old cat, they're going to lose weight sometime, right? 12, 13, they get something and then they start to melt on us, right? The muscles melting. That's terrible. I shouldn't be saying that, but it's the truth. And we don't recognize 1 pound off a 12-pound cat is 8%, right? Okay, 150-pound person, that's 12 pounds. That we notice, we see. So again, it's really, really important to give owners all these tips. And if I was in practice right now, I would have it on my website. I would be, like you said, front desk, technicians, all these little tips. And every time I hear something new, I'd be adding to it because they're just amazing creatures to live with. They're just fascinating, but we've got to do our part. We've brought them into our world and we've got to care for them. And I think we really have to think and give our owners all the tools that we can, any clue. I was listening to a talk on, inflammatory chronic enteropathy, inflammatory bowel, microbiome. And somebody mentioned that, I was trying to get weight off my cat, and somebody said, give it some cucumbers. I chop up cucumbers and I leave a little dish of cucumbers. And I think, I'm writing that down. I wrote that down. It wasn't in the notes, the notes for the cover. I'm writing that down. It's a tip, I all that kind of stuff, and just keep compiling that stuff because that's how we're going to win. We're going to win with these guys. I just want them to live longer and better quality of life. And I think we can do that if we really take the time to educate and think about it. And I know we're all busy, but that's what pet parents want. They want us to talk and tell them about pet food, how to feed, crazy auto feeders, change the time up. The mouse doesn't always come out at a minute, all that crazy stuff, right?
Yeah, absolutely. They want that education. And sometimes we, again, just don't have the time. And that's when you need to utilize your whole team. And that's where messaging is so important, right? So we're all used to the cups that we can get for dogs, but a gram scale, like we all have gram scales in the clinic, but we aren't using them for nutrition purposes. We're using them for weighing a hamster, right? But if we could educate our cat owners or our smaller pets to use a gram scale, little hints like that are really important because it's sometimes really difficult and can be quite variable depending on the measuring spoon or the measuring cup that cat owner is using. And again, really appreciate you being on because it's something where it's a difficult topic. Even the hint that you made with the 150-pound person, that correlates so much to a human when they hear that, because that 1 pound doesn't sound like a lot. But when you are able to extrapolate that as an example, it really hits home for that pet owner. I will say, I need you guys as nutritionists to make a diet that makes the dangling fat belly go away. It just never goes away, but I love it anyway.
I think with research, if we start embracing earlier on better diets, I'm going to be honest with you, I actually make my cats food, some of their diet. I do. I cook for them. I'm crazy, but I do. And it is a super low carb diet and it's super easy to make because it's chicken meat and some oils and my vitamin mineral mix. And, I make it ahead of time. So they're on a super low carb diet. And then I use some of the dry for treats. That's again high protein, low carb, and it's all over the place. And I use I have a client that makes these chicken brittles, little dry chicken treats and things like that. So it's really interesting to see my cats raised that way. And I actually even started them on critical care diets, are another low carb diet. And they were so anemic and just, they're from the South. They had every like foreign parasite and all that stuff on them, so I wanted to dip them but I fed them this critical care diets. These cats are amazing. I have more hair than 3 cats should ever have. They are lean cats. There's food out all the time for these cats. They're lean, they're hunting, they're looking around the auto feeder. When's that mouse coming out? And they're lean. And I think a lot of it is, again, the appropriate behavior that feeding behavior that I'm matching, environmental stimulation. And again, that really, I call it the mouse-like diet. It's my magic mouse-like diet, but their body, and you can feel like the muscle definition of them, and they don't have that little floppy belly. It's really interesting.
Don't shame the floppy belly. Oh, my cat found it. Oh, it was fantastic talking to you. Love the fact that we are kindred spirits in training and really appreciate all that you do. Such an important topic because I don't know. I mean, I feel like 75% of the cats that I see in the ER are obese, not even overweight, right? And it's really hard for an owner to hear. But in the ER, I oftentimes struggle to talk about it because I have so many other important topics of life-threatening conditions. But again, so important that we discuss it because all these comorbidities are truly itises for cats. Dr. Donna, really appreciate it. Love what you do. And so thankful that you were on today's Beckerel podcast. Thank you.
Thank you.